and the migraines and the lack of mobility in my neck. So it was about that time that I really started searching for additional help with the pain. I didn't like the feel of medicines. I really wanted to be medicine free. They did an assessment with me and convinced me to go through the program. We talked about nutrition, sleep, exercise, just the whole body experience with the managing of pain. I realized it's okay to move and hurt. They helped me train the brain, so to speak. So I used to, make a lot of faces when I was in pain, and I realized I had worked on stopping that, and that helped a lot. It was just such a wide range with the nutrition, the psychology with it, the physical therapy, the exercising, all of it together, and then just putting it in a package for me to go home with and work with all of the tools that they had given me.
The patients who come here are basically, pain has hijacked just about every area of their life, and they have tried just about everything that there is in terms of traditional medical approaches. They have tried all the medications, the interventions. Many have had surgery, physical therapy, and maybe cognitive behavioral therapy, but it's been piecemeal and not happening all at the same time with an integrated team that is working together. When a patient comes to see us, we begin with an evaluation that's fairly comprehensive. And a patient can get referred to us through their physician or another provider, or they can call if they've heard of us in another way. And we will have an evaluation that includes the primary members of our team. So we have psychologists, physical therapists, a nurse, and a medical director. And so the patient will first start by coming in and meeting with one of the PTs, the physical therapist, one of the psychologists, and the nurse to evaluate their current level of physical functioning, the psychosocial issues that we usually see go along with pain, like depression, anxiety, difficulties working, difficulties with family life. And then Lynn will evaluate their medications and work with our medical director to taper them off of anything that isn't helping anymore. Usually they're taping off of opiate pain medications. If on both sides we feel like it's a good fit, then they work with our admissions coordinator to get insurance verification. Most insurance companies do cover the cost of the program. People who have very high stress and anxiety levels tend to find that that goes along with increased pain. So we will educate them about that connection, what's going on in their nervous system to create that, and help them with different strategies like stress management techniques, relaxation techniques. We will talk about how to more effectively communicate with their families without focusing as much on the pain, because talking about the pain and focusing on it mentally does increase pain. We often hear that in 4 weeks, patients are feeling very empowered and feel like they're back in the driver's seat of life. We're very proud of our outcomes. They're excellent. And in 4 weeks, we see that the average patient will report that their pain severity has reduced by 1/3 or over 1/3, that the degree to which their life is being negatively impacted has reduced by over 1/3, and on average, depression ratings tend to reduce by 50% or more. These folks come in hopeless and desperate and very dejected and leaving. It's amazing to see the transformation.
My pain is lessened, yes, it is decreased immensely, and I'm not on medications. And not to say that there aren't times where it does flare up and I can get a little discouraged, but I was taught this is going to happen, you can't predict the triggers, and with that helps me to get through when I do sometimes have a little bout with the pain. I do my stretches, and I do icing. I walk 30 minutes every day, and I have some stairs that I do as well, but I work on it every day. I have seen such a decrease in the pain, in the migraines. My mobility has come back with them fully in my neck. So to me, I know if I stop, I'll just be where I was before. I feel more in control, where before I was so scared, I felt I was losing control of being able to manage my pain. And so that's a great way to put it. I feel in control.